by definition, blood pressure is the force exerted by the blood against the walls of the blood vessels. There's a lot of physics involved in blood pressure. Specifically looking at resistance and friction that's created as the liquid, the blood, moves against the walls of those vessels. And all that plays a part in actually determining why blood pressure is too high or too low or what have you. Now, I'm sure you're familiar with these terms, systolic pressure and diastolic pressure. When you go have your blood pressure taken, you get two numbers, the top number and the bottom number. And the average blood pressure is about 120/75. Now, what does this top number mean? Systolic pressure. To what does that refer? Systolic would be the maximum pressure in the arteries during what?
Constriction?
Not constriction, but contraction of what? The left ventricle. Remember, the left ventricle of the heart is the major pumping chamber. That's what forces the blood out of the heart into the rest of the body, systemic circulation. So the systolic pressure is the pressure in the artery where you're checking the pressure. Typically, what artery are we checking when we do blood pressure? The brachial artery right here in the brachia, okay, in the upper part of the upper limb. So that systolic pressure is the pressure in that brachial artery when that left ventricle is contracting. When that left ventricle contracts, it's very high pressure. It forces the blood out of the left ventricle into the aorta and then into the vessels around it. Which means then that the diastolic pressure is the pressure in that brachial artery when the left ventricle is relaxed. And it should be a much lower pressure. If this diastolic is very high when your left ventricle is contracting, that means that for some reason there's an awful lot of pressure in there. There's an awful lot of resistance downstream or something that's keeping that vessel kind of stretched. These elastic arteries very close to the heart, as I mentioned, stretch in response to that pressure. It's kind of a mechanism to absorb some of that force. So that's what systolic pressure refers to and diastolic pressure refers to. The pressure in that particular vessel during these events in the heart. Ventricular contraction, ventricular relaxation. Now obviously the pulse that you feel when you take a pulse is that elastic expansion and contraction, or recoil I should say, of those arteries in response to that systolic pressure. That's why you can feel the pulse. You're actually feeling the arteries expand and then go back to their original shape. Expand and relax.